Hi, everyone, and welcome back to Health First. Today I'm here with Dr. Kotak, who is a pediatric dental resident. Hi, how are you?
Hi, I'm good, Emily. How are you?
I'm great. Thank you for joining me here today.
Yeah, it's my pleasure.
Thank you. I'd like to start off by asking what influenced you to pursue a career in dentistry?
So I actually grew up in a family of healthcare workers. My parents were both physicians. And I think that I was always kind of nerdy growing up, but I also knew what I didn't want to be. And I have so much respect for physicians, but my mom's an anesthesiologist and her long hours and just high stress environment, it made me want to steer away yet stay in the healthcare field. So I started shadowing a dentist back in the day, and I realized that you're still helping people, with their oral health, and you're also aesthetically speaking helping people, whether it's children or adults. And I think the fact that you can really improve someone's self-esteem, get them out of pain, it's pretty rewarding. And so I think that a combination of factors led to me going into dentistry.
Yeah, and why did you choose your specialty?
Peds, oh my God, I love working with kids. So I was a general dentist for about almost 6 years. I completed my DDS from University of Colorado. That was 2014. And I think most of the offices that I worked at had a heavy focus on children. Now, you don't have to be a pediatric dentist to treat children. You can, as a general dentist, you can treat kids, which I did for a while, but there was a lot of cases that were beyond my scope. And by that, I mean, I didn't have the necessary training to do certain procedures or deal with very anxious kids who needed forms of, sedation, like conscious sedation, general anesthesia, things that I had. You can only get the training if you're doing residency. So I often felt like I was a middleman for a lot of children where I couldn't provide the care that they needed. And I always had to refer them to the right person. And I think at some point I decided, I know I'm good at this. I know I want to get better at this because there's so much scope for growth. So I decided to go back and do residency, and I genuinely really enjoy working with kids. I think that if you can impact a child's life, it's so rewarding, and kids are hilarious. Like, they just say the cutest things, and I have fun at work. And I'm not saying every day is a breeze. Yes, there are days when kids are screaming bloody murder and it's not fun, but that's when you come in, and with your skills you can really make a difference to a child's life.
Yeah, definitely. And can you tell me a little more about your profession and what you do?
So I am a pediatric dental resident at Temple University Hospital in Philadelphia. It's a 2-year residency program after, finishing your DDS or your DMD, which is your dental degree. What we do is we deal with children and those with special needs. Usually it's 0 to 17 years. And then a lot of the times we see older, patients that may have any special needs as well. So we're doing regular dental procedures, checkups, cleanings, fillings, caps, spacers, but we're also dealing sometimes with very anxious kids. There could be a 3-year-old who has a mouthful of cavities, which is unfortunate. In which case we have to sedate the children. So, or we work with an anesthesiologist who puts them to sleep. So when they're asleep, we can get all of the work done. So there's a lot of behavior management, and by that I mean, with adults coming in, sometimes adults have anxiety too, but usually when they sit in your dental chair and you say open your mouth and it's what I'm going to do, it's a very it's not as unpredictable. With kids, sometimes I literally had a kid yesterday in the morning who felt like this because she was terrified. And so it's a lot of talking to children. You have to be very careful with the words that you use. You're never going to say, okay, I'm going to give you the needle now. We never use that word at all. You also don't want to lie to a child. So it's about how you present it to the kids. So for example, if I'm going to put on my anesthetic jelly onto the gums, I always say, ooh, I'm going to put on my bubblegum jelly. And then I just distract them. I talk about their family, their brothers and sisters. And then I say, you know what? Have you watched Frozen? You know how Elsa has her frozen water? I'm just going to spray off this bubblegum jelly with my frozen water, but it's really, really cold. So why don't you take some big smells? And when they're taking big smells, I have the nitrous oxide, which is laughing gas, which really helps to calm them down. So it's all the words, you distract them, use the right words, and a lot of the times, kids may not even realize that you've given them the anesthetic. So I think that's a large part of what we do differently from general dentists. And a lot of the times, general dentists will, the moment a child screams or cries on the dental chair, they refer them on to a pediatric dentist. So we're doing things to improve their smile, aesthetically speaking, and we're also treating big cavities and abscesses. And it's not only baby teeth that we're treating, because after the age of 6, they start having permanent teeth come in the mouth. So if those teeth have issues with them, we're also treating the permanent teeth. So that's kind of a couple of the things that we do.
Yeah, and what do you like most about your profession?
Just being able to help a child. Sometimes it's heartbreaking to see kids that have received, no dental care for the first couple of years of their life. And, it's almost to the point of neglect. And they come in with a mouthful of infection and, getting them out of pain, being able to help them, restoring their oral function and also their self-esteem by giving them a better smile. So I think that truly makes a difference. And a lot of the times a lot of our jobs when we meet parents for the first time is talking to them about, what's the right way to brush your kids' teeth, or what's the right age, and what are the right foods to give them, what are things you should avoid, how much toothpaste, what kind of toothpaste, what about a pacifier, what if my child is sucking his thumb. There are just so many things that we can discuss, because half the issues can be avoided if we can really provide that information early enough to the parents so they can avoid all the mistakes.
Yeah, definitely. And as you know, the COVID-19 pandemic has greatly affected the world and continues to do so. So how is it like working throughout the pandemic?
So our office was shut down for about 3 months in 2020, I believe, like April, May, and June. But starting July, we went back pretty much full swing back to work. The things that changed is we really upped our PPE. So, the double masking, wearing a full, a head cover, a jacket, disposable jackets, feet covers, everything head to toe. We really had to protect ourselves. There was a lot of data that was released that actually the spread of COVID-19 amongst dentists was surprisingly low, considering that we work in people's mouth. And also we're pediatric dentists, so we're dealing with children less than the age of 12. So most of them are not vaccinated. But yeah, we followed the law. We all got our vaccines when we had to. Even now, we never roam around without a mask inside the hospital. And it's been fine. There are certain procedures we started doing a little differently to avoid aerosol, which is basically when you're drilling into a tooth or you're cleaning a tooth, there's a spray of water and air being blasted at the teeth. So if there's any, viral infection, it can, potentially spread. But we also have a great suction system that grabs all of that. So certain procedures were changed up, but majority we've gone back to working just the way things were.
Yeah, I've heard from many dentists that the spread of COVID in dental offices is very low, which is great.
Yeah.
To end off, can you give a few words of advice to people hoping to pursue a career in dentistry?
Yes. So I think it's important to get into dentistry for the right reasons. A lot of the times, if you are under the impression that, this is going to be a lucrative profession, and if that's all that you're thinking about, it can get very, very stressful. I think it's important to remember that you're there to help people. Do what you love. If being a general dentist is what you love, do it. If you feel like you want to specialize, do it. If you want to work in a community health center and that's what you're cut out for, so be it. You're there to help people. And I think if you can go to bed knowing that you help somebody, that's the right reason to get into dentistry. So what can you do? Make sure of course you want to keep your grades good when you're in college. You want to try and do as much voluntary work that you can. Even dental offices, working as a dental assistant, working as front desk, just shadowing dentists. I think that's a great way just to get an idea of what goes into it. I'm in Philadelphia, so we have an event called Moms in PA, or Mom in PA, which is Mission of Mercy in Pennsylvania, where we are providing free dental care to kids on 2 dates. I believe it's September 18th, 17th, I'm not sure, but there's many events like that in your city. Sign up for that. Even if you're not a dentist, there's a lot of roles that you can play. And then putting that in your application just shows that you are genuinely dedicated. And I think your essays are important, trying to keep your grades high, getting any kind of like TA experience when you're in college, all of these things that show some sort of leadership, show initiative. All of that is great. So words of advice, yeah, just have the right attitude, and I'm sure that you'll get into dental school.
Yeah, thank you so much for the great advice. And those are all the questions. So thank you for joining me and thank you for your time.
Yeah, thank you for having me, Emily.